particularly either in Nepali or both mixed in Nepali and English. Today I will be speaking in only English. So let's start the topic. So what is necrosis and apoptosis? I have already spent a lot of time during my other video lectures. So let's begin with this. Necrosis is a cell death due to the lethal injury. Now, talking about the cell death, there are two types of cell death generally. The cell death can be either through necrosis and apoptosis, or cell death can be through apoptosis. Generally, there are other methods of cell death, but majorly we will be speaking about only two type of cell death, that is either necrosis or apoptosis. Now, what is necrosis? Necrosis is a result of denaturation of intracellular protein and enzymatic digestion of the injured cells, and in this the contents often leaks out, so there will be inflammation. The most important about the necrosis is that in this there is inflammation, but in the context of apoptosis there is no inflammation. First of all, we will be talking about morphological changes in the necrosis. Whenever we are asked to talk about the morphological changes, we will be talking about in two contexts. First one is cytoplasm and another is nuclear. So in cytoplasm there will be increased eosinophilia in H&E stain, and there will be more glassy homogeneous look of the cell. And another point is the cell may appear as a tombstones or ghost-like appearance. Tombstones or ghost-like appearance. As the outer architecture is maintained, suppose this is a cell, the outer architecture is maintained, but inner everything, cytoskeleton and every cytoskeleton proteins are destroyed. So there will be appearance of a ghost-like or tombstone appearance, and more glassy homogeneous means there will be more pinkish nature of the cell, that is cytoplasm content will be more as compared to the nuclear content. And there will be vacuolations and myelin figures can be seen. Myelin figures are like this. These are called myelin figures. There will be deposition of myelin figures, and there will be calcification. The calcium get deposited as in the tissues, resulting in the different type of structures forming calcification. We will be talking detailedly about calcification in the topic calcification itself. Now, necrosis in morphological changes, I have came across another topic, that is nucleus. In nucleus, there can be three things. Either it can be pycnosis, means there will be condensation of chromatin and hypereosinophilic cytoplasm. The next point is karyolysis. The term lysis means there is a breakdown. Means in this the nucleus is break down into small part which may be disappeared after some times, and this causes decrease in basophilia and increase in eosinophilia. And karyohexis is there will be the fragmentation of nucleus. The nucleus should be like this, as mentioned in the pycnosis, but not so dark, but should be somewhat like this in organized manner. But during the karyohexis, there will be the fragmentation, means there is one fragment, there is one fragment, there is one fragment, and there is one fragment. So there will be fragmentation of a nucleus, which is also called as karyohexis. With the passage of time, nucleus totally disappear. Means I have already talked about that karyolysis. After karyolysis, there will be complete disappearance of the nucleus. Now, the pattern of a tissue necrosis can be coagulative necrosis, liquefactive, gangrenous. There are 6 types of necrosis. So, coagulative, liquefactive, gangrenous, caseous, fat, and fibrinoid necrosis. So, talking by one after another, the coagulative necrosis is the most common pattern of the necrosis. Architecture of the dead cell is preserved for some day. Means the architecture of the cell or cytoskeleton or the outer covering of the cell is protected in this case, but the inner inner cytosol is already destroyed, and inner nucleus, both nucleus and cytosol are destroyed. So there will be appearance of a blank cavity with outer cell architecture constant or preserved for some time. Mostly result from the ischemic insult to solid organs such as heart, kidney, and spleen. Generally, mostly seen in heart and kidney, and sometimes in spleen. The form texture of affected tissue. So to know about the gross of the coagulative necrosis, you can refer me to my another video. But in this also, there will be form texture of the affected organ can be seen. The texture is formed and localized area of coagulative necrosis, resulting in the infarct. Now talking about coagulative necrosis, you can see this. This is a cut section. This is a cut section of kidney, and in this is normal region. You can see the normal region, and this area is well-shaped infarct, and this results in the coagulative necrosis. This is the example of coagulative necrosis. In this figure, this is normal, and here you can see infarct. Means this region are infarct. You can see pinkish appearance. There will be outer architecture or distorted architecture. Means the constant. If you see this, there is a glomerulus, a round type glomerulus. Here the architecture is disturbed. Architecture is maintained, but the shape is disturbed. Now coagulative necrosis, you can see in this. There will be high basophilic cells. Means eosinophilic and basophilic ratio there will be constant. But in this, you will lack basophilic cells. Means there will be pinkish cell without, and the cell have only outer architecture, no inner content. So this is the example of coagulative necrosis. Now talking about the liquefactive or polycoative necrosis, the digestion of dead cells. The digestion of dead cells in the tissue transform the tissue to a liquid viscous mass. Means in this, the digestion of dead cell result to pus formation. One of the characteristic features is pus formation in liquefactive necrosis. Seen in the ischemic injury, this is mostly seen in ischemic injury, bacterial infection or fungal infection. Three things, and in brain it is mostly seen, brain and abscess cavity. Mostly it is seen in brain. The best example of liquefactive necrosis is brain. So this is the part of the brain. Here you can see there is liquefactive necrosis. Means you can see pus filled area, the gross appearance of the liquefactive necrosis. Now talking about gangrenous necrosis. Let me add some points about the liquefactive necrosis. Liquefactive necrosis is due to why it is occurring is that increase in lysosomal permeability. This lysosomal permeability allows the enzymes to leak out or pass out, and these enzymes cause damage of cell. That is also called hydrolytic damage. So previously we were talking about there will be constant tissue architecture in the coagulative necrosis, but in this there will be disappearance of the tissue architecture. Now the examples of the liquefactive necrosis are ischemic infarction of the brain. There is no stromal support therefore of absence of a collagen, and the brain have a presence of more liquefactive enzymes, and another is infection of different parts can cause liquefactive necrosis. Now let's talk about gangrenous necrosis. Gangrenous necrosis most common site is lower limb, and there are two types of gangrene in this necrosis. There is wet gangrene and dry gangrene. In dry gangrene, tissue architecture is preserved, so dry gangrene is acting as a coagulative necrosis. and wet gangrene is acting as a liquefactive necrosis. So when we say about the gangrenous necrosis, it is both coagulative and liquefactive necrosis. And wet gangrene is due to bacterial contamination or toxins or enzyme release. And in this dry gangrene, the tissue architecture is preserved. That is the main thing. An infection with a gram-positive Clostridium mulci, the gas gangrene is another feature of a gangrenous necrosis. We can see in the case of Clostridium infection. Now talking about caseous necrosis, it is called cheesy appearance. Caseous necrosis is also called cheesy appearance or cheesy necrosis. The cheesy is due to yellowish white debris. Yellowish white debris. So this causes cheesy appearance and seen in tuberculosis, most commonly seen in tuberculosis. On microscopic examination, we can see coagulative and liquefactive necrosis. And other thing in microscopic examination, we can see the necrotic area is structureless. Homogeneous sleeping means high eosinophilic with granular debris and surrounding inflammatory response. And it consists of epithelioid cells. The epithelioid cells is also called as sleeper cells. The epithelioid cells appears sleepers-like cells. Sleeper-like cells. And Langhans giant cell and lymphocytes, generally granulomas, can be seen. In caseous necrosis, this is the lung. In the case of tuberculosis, lung of a person infected with the TB. So you can see this area. This appear as a Cheddar cheese, means the cheese type appearance is seen in this. So we will observe epithelioid cells. If you see in this type of cells, it may not be visible. Let me zoom a little bit. Okay. So here the cell you cannot see, I think. Let me draw for you. Here the cell can be like this. This is epithelial cells, sleeper-like cells. Means the cells appearance is like sleeper. And this is lymphocyte, the blue dot area. And caseous necrosis, you can see the out here. This is normal cell. Here it is caseous necrosis. This is also caseous necrosis. The in this area you can see something is covering the whole area. You can observe this around the necrosed area. There will be deposition of different giant cells forming Langhans giant cell, and this is caseous necrosis, lymphocytes and epithelial. So these are the components of the general components of the caseous necrosis. You can see this much area is caseous necrosis. This is normal tissue. Now fat necrosis. In fat necrosis, it may be due to two types. One due to enzymes and another is due to trauma. In enzymes, we have acute pancreatitis. And another is breast injection. Trauma, in the case can be trauma or the case can be enzymatic due to acute pancreatitis. Refer to the focal area of fat distribution, best encounter in breast trauma or due to pancreatitis. Grossly, if we see, there will be chalky white areas. It is due to fat saponification. So let's talk about fat saponification. The enzymes gets released. In acute pancreatitis, enzymes gets released. Lipase, most important enzyme, lipid dissolving enzyme or lipid breaking enzyme is released, it acts on lipids with co-lipase. This much detail you may not need. Okay, then acts on lipids and release fatty acid and combine with calcium. So fatty acid combining with calcium, this action is known as saponification. On microscopy, you can see shadowy outlines of a necrotic fat, basophilic calcium deposits. So one another point is that when microscopically you can see these calcium deposits react with fatty acid, it results in bluish white appearance of the cells, and there will be some inflammatory reaction. These all are chalky white deposit. You can see this all area, and this is example of fat necrosis of pancreatitis. Now in examination, we can see the fat cells have stain that is completely washed up, so fat cell cannot be properly detected. But you can see this fat cells, and in fat cells, let me draw for you the microscopic example for the fat cells. Normally, the fat cells may have this type of appearance. One side there will be fat cells, and in one side there will be eccentrically placed nucleus. And this is a normal fat cell. But during the this fat necrosis, the fat cell appear as a outer pinkish area, and inner the here unnucleated fat cells, and outer is pink cytoplasm, and basophilic deposits can be seen due to also called as a calcium deposits. It is example of fat necrosis. Fibrinoid necrosis seen in the immune reaction involving blood vessel. Suppose this is a blood vessel, and immune reactions are deposited here. So the acute inflammatory cells can be seen around the fibrinoid. Complexes of antigen antibodies are deposited in the walls of the arteries, as I have already said. Microscopical examination, if we do, then we can see there will be the pink, bright pink amorphous appearance, or there will be hyalinization of the blood vessels, resulting in the increased pinkish nature of the cell, the pinkish appearance of the blood vessels. This is the fibrinoid necrosis. This can be seen. This is a part of a fibrinoid necrosis. Here there is a normal appearance. This is a blood vessel, so we can see blood vessels have a pinkish appearance. Now, after talking about the necrosis, we will be talking about apoptosis. So in apoptosis, we will be speaking a bit faster. It is derived from the Greek word used to describe the falling of individual leaves. So during the literal meaning of apoptosis is falling off. Now, programmed cell death, it is also called programmed cell death or regulated cell suicide program. In this, the plasma membrane remain intact, but the structure is altered, so become target for phagocytes. Means the cells have no inflammation in this. Now, occur during development throughout the adulthood. Talking about the physiological and pathological condition where the apoptosis occurs, there are different physiological conditions such as organogenesis and neovascularization and killing of inflammatory reactions after the completion of their functions, and elimination of autoreactive are some example of physiological apoptosis, whereas on pathological sites we have chemotherapy or radiotherapy. In chemotherapy or radiotherapy, both necrosis and apoptosis occurs. And another is concealment bodies seen in viral hepatitis, example of apoptotic body or apoptosis. Now, same example during embryogenesis, cell death in a proliferating cell population, involution of a thymus in early stage, death of our cells that have served their useful purpose. Pathological, I have already talked about the cell death of cytotoxic T cells. So this is the example of apoptosis. A morphological change, in general, all the injury, there will be cell swelling, but this is only the case where there will be cell shrinkage. So most important point, chromatin condensation. The chromatin get condensed, so there will be increase. If there is nucleus, there will be chromatin condensation. So this appears. Sorry, I have made with a red pen. Most blue. So suppose this is a nucleus, then nucleus gets condensed, so chromatin condensation. Formation of a cytoplasmic bleb in apoptotic bodies. Cytoplasmic bleb is, suppose this is a cytoplasm, this type of bleb formation occurs. This is called bleb. Is the extension of a cytoplasm of the cell. That will be the target for phagocytosis. Now, mechanism of apoptosis, there are initiation phase and execution phase. Initiation phase, the caspase become catalytically active. The initiation caspases are 9, 10, 9, 10 and 8, 8, 9, 10. 3 caspases. The execution caspases are 3 and 6 mostly. The 3 and 6 caspases. Initiation of apoptosis occurs principally by the signal from the two distinct pathways. The intrinsic or mitochondrial pathway and extrinsic or death receptor pathway. The extrinsic is responsible for death receptor pathway, and intrinsic is responsible for mitochondrial pathway. The E and X of the extrinsic pathway resembles, means this is a mnemonic, not a just fact rule I have created. E for 8 and X is for Roman number 10. EN. So the caspase 8 and 10, 8, 9, 10 are generally used in extrinsic pathway, and the other caspases are activated in intrinsic pathway. The pathway is simple. The extrinsic pathway have a receptor called as Cas receptor, and the ligand bind to it. It is also called Cas ligand. Both when binds to this activate a different protein located inside the cytoplasm, which is called as Cas associated depth domain or adaptive protein, FEDD adaptive protein. This activates, in turn activates caspase to procaspase to caspase. This initiator caspase. What are the initiator caspase? 8, 9, 10. So this get activated and it activates the executional caspase, and this executional caspase do two functions. One is breakdown of cytoskeleton and another is endonuclease activation, which causes the breakdown of nuclear chromatin and nucleus. Now another is a mitochondrial pathway. Generally, the check and balance is for the apoptosis. For apoptosis, check and balance is given by growth factor signal. So when there will be no growth factor signal or growth factor signal withdrawal or DNA damage by radiation, free toxins, free radicals, or misfolding of the proteins, the endoplasmic reticulum gets stressed, and this is sensed by BIM and BID majorly. These are called sensors, which include under BCL2 family or BCL3. Some books said BCL2 family, some books says BS3 only family. So BS3 only family, and this all causes activation of the pro-apoptotic gene, such as BAX and BAK, and this causes appearance of the channel inside the mitochondria. This channel allows the leakage of cytochrome C and other apoptotic proteins such as Ep04, and this both together forms apoptosome, and this apoptosome activates the initiator caspase. Now this initiator caspase gets activated, and this initiator caspase again activate executional caspase, and the same reactions occur as similar to the extrinsic pathway. The executional phase of apoptosis Endonuclease clips DNA. Caspase promotes fragmentation of nuclei. Now, removal of dead cells. After the execution phase and initiation phase, both phase has completed. The apoptosis progress for the removal of the dead cells. Suppose this is the cell, normal cell, and this undergoes. This is a bleb formation, and it has given signals called as eat-me signals. Now it is ready for phagocytosis. So this can be helped by these signals. It is due to phosphatidyl serine and thrombospondin. One thing I have forgot to mention here, during the release of cytochrome C and APF, another channel also activate in this release SMAC or Diablo protein. SMAC and Diablo are inhibitor of apoptosis, means those processes which inhibit the apoptosis that are inhibited by SMAC and Diablo, means this will favor SMAC and Diablo will favors in apoptosis. Now, features of necrosis and apoptosis. Difference between necrosis and apoptosis is the most important question, most IMP question. You can copy this chart or you can screenshot this chart. So necrosis, there will be cell size swelling or enlargement. As I have already said that during every cell injury there will be swelling except in apoptosis, so there will be shrinkage. Nucleus, if you see, there will be changes in the nuclear materials in the context of the necrosis. For the apoptosis, there will be complete fragmentation into small sizes. So there will be three changes: pycnosis, karyolysis, and karyolysis sequentially. Whereas in the apoptosis, there will be fragmentation into nucleosome size fragments. The plasma membrane of the necrosis is disrupted as there will be inflammation due to the disruption of plasma membrane and leakage of the cytoplasmic protein to the surrounding tissues. And in the apoptosis, there will be the intact or altered structure. So the cell structures only alter. Suppose this is bleb formation. So bleb is only formed, but it is not completely released off. Later on, this is eaten by phagocytosis. So there will be no any reactions around the cell. And now the cellular contents enzymatic digestion may occur. In this, the cellular content is intact and apoptotic bodies may be present. Adjacent inflammation is frequent. In this necrosis, there will be no adjacent inflammation. If we say about the necrosis, it is mostly pathological. There may be few cases of a physiological, but it is completely or maximally pathological. But apoptosis is mostly physiological and may be pathological after some forms of cell injury. Now let's talk about two things. Normal cell, if there will be apoptosis, what will occur? And in normal cell, if there will be occurrence of necrosis, what will occur? This is a normal cell, there will be reversible cell injury and recovery. Means this stage is similar to both. And after that progressive injury, there will be necrosis. In this, breakdown of the plasma membrane, organelles, and nucleus, leakage of the contents. This figure I have taken from Robbins' 9th edition. 9th and 8th have same photos. So 8th edition, it is a bit older edition. And now the swelling of endoplasmic reticulum mitochondria, the membrane blebs is present in a reversible cell injury, but in progressive injury, this bleb get disrupted and there will be inflammation, presence of neutrophils around the cells, and there will be leakage of the contents. So amorphous density in the mitochondria can be seen, myelin figures deposition can be seen. In this apoptosis, cellular fragmentation of nuclear fragmentation can be seen, and there will be phagocytosis by the macrophages without any inflammation. So that was for apoptosis and necrosis. I hope you have enjoyed. If you have any queries, you can drop your queries down in the comment section. See you in the next video. Thank you.